Hey there, Dr. Dave here. Welcome to my new office. What do you think? It's actually the Delta Sky Club in Atlanta, the A concourse, because B, C, D, E are all closed, and F, frankly, was just too far to walk. Anyhow, haven't traveled for a month, and I'm on my way now to see my dying mom, Anna, 90, in Youngstown, Ohio. More about that later, but for now I just got a text from a therapist with whom I consult frequently, and she had a couple weeks ago sent me a young man who was having a lot of rage, irritability, irascibility, lability, reactivity, impulsivity. You kind of get the picture, and at the same time his brain wasn't working, a lot of brain fog, poor concentration, poor attention, no joy, no motivation. That's that mixed, wired, and tired profile I've talked about before. The speed and weed person, the Adderall Ambien person, the puppy upper doggy downer person, the black coffee red wine person, guilty. At any rate, I tested his neurotransmitters and he came back with really, really high dopamine, low norepinephrine, and low PEA, phenylethylamine. What does that tell me? Well, it's very consistent, wholly consistent with his clinical presentation. The dopamine, elevated, responsible for that irascibility, that lability, that hair trigger temper of his that's getting him into trouble at work and at home. At the same time, he has poor concentration and attention, poor get up and go, poor gumption, poor motivation, and in addition to that high dopamine, he had low norepinephrine. I see this pretty commonly. And then low PEA, phenylethylamine. Easy fix for the most part. We didn't want to use medications. I need to lower that dopamine. And one way I do that is to convert it to norepinephrine. What? So if you think about the biochemical cascade, you've got tyrosine, which is then an amino acid, by the way, which is converted to L-dopa, and then dopamine, and then norepinephrine, and then epinephrine. All of those should be pretty even on neurotransmitter testing. And when I see this wide a gap between dopamine and norepinephrine, that means the enzyme that converts dopamine to norepinephrine, wait for it, dopamine beta hydroxylase is just simply not working. Now, I cannot give you that enzyme, so what do? Well, we know what the vitamins and minerals are that support that neurotransmitter enzyme, and that basically would be roughly as follows: colon, drum roll, wait for it, high dose vitamin C, niacin, and copper. And so that's what I will give this individual. At the same time, I'm going to give him the ACE supplements for lowering that dopamine, all important. And that would be a little bit of GABA support. I use GABA Boost, and then pretty high dose NAC, N-acetylcysteine, organic lithium, and a good probiotic and fish oil. It's really pretty simple. That's how I lower dopamine, or at least right-sized dopamine. So, fish oil, GABA Boost, organic lithium, N-acetylcysteine, and then help convert that excess dopamine to norepinephrine by using a single supplement that contains all of those things: vitamin C, niacin, copper. That's pretty simple. Now, in addition, I have to give something to him to increase that PEA, which is your runner's high neurochemical. So I'll give him my ACE product, my favorite, one that I take every day. Some people would argue I should take more of it, frankly, and that's for my own ADHD symptoms. And that's Cogniben, C-O-G-N-I-B-E-N. It's one of my best-selling agents, and I use that for low PEA. So that's going to be my approach to this gentleman in order to lower the dopamine, increase norepinephrine, increase PEA, and thereby decreases irritability, irascibility, lability, reactivity, impulsivity, anger, and improve his focus, concentration, motivation, gumption. That's G-U-M, gump, P, shun, S-I-O-N, T-I-O-N. I really don't know. Not important now. And then also his joy and pursuit of happiness. Okay, that's just a case presentation here in the Delta Sky Club in Atlanta, because I'm on my way to see my sick mom. All right, that's all I got. Thanks. Peace out, and be safe and stay sane. Thank you. See you.